The TV6 Health Watch is brought to you by Alive, giving you more minerals and vitamins than leading brands. Distributed by H&G Enterprises Limited.
For many men, getting older doesn't just mean a few gray hairs or needing more rest. It can also bring changes in energy levels, sleep, mood, and even overall confidence. According to urologist Dr. Vimal Sitahal, declining testosterone, commonly referred to as male menopause or andropause, is more common than many people realize.
Male menopause, andropause, late onset hypogonadism, or the correct would be androgen decline in the aging male, is quite common in our population, and then for all men. We do go through a version of menopause where our hormone profile does decrease, our testosterone does decrease. It actually affects about 10% of men by the time we're 50 years old, and about 20% of men by the time we're 60.
As men age, Dr. Sitahal says testosterone levels naturally decline. Symptoms can range from fatigue and low sex drive to depression, poor concentration, and erectile dysfunction. But Dr. Sitahal says there is no one-size-fits-all solution, which is why proper testing is important before any treatment begins.
We know our testosterone decreases as we get older as men. Now, your testosterone drives your testicles to produce testosterone. Or rather, your pituitary gland drives your testicles to produce testosterone. That axis is what becomes bothered as we get older as men. And we think overstimulation of that axis from a high testosterone when we were younger causes a decrease in what we call receptor avidity. Now, that is basically the testosterone that is there. While it is there, it's no longer able to be converted to the active form of testosterone quite so well anymore. And also the ability for your testes to produce the testosterone is decreased.
He explains that as men get older, the body's hormone system changes, making it harder for testosterone to work effectively and reducing the body's ability to produce enough of it. And while low testosterone may sound straightforward, Dr. Sitahal warns it can sometimes point to other underlying medical issues. That is why medical testing helps doctors determine exactly where the problem is coming from.
Now, if it is that the testosterone is low, then we're going to assess whether it is coming from the brain chemistry or whether it's at the testicular level. If it's coming at the testicular level, then you can have testosterone supplementation. If it's coming from the brain level, there are ways that we can find out if it's a tumor of the brain, and it doesn't have to be cancer of the brain to be a tumor of the brain. And then we can treat from there.
Depending on the results, some men may benefit from testosterone therapy, while others may simply need healthier lifestyle habits. Dr. Sitahal says regular exercise, proper sleep, and better eating habits can improve overall health. He wants men to stop suffering in silence and seek medical advice early instead of waiting until symptoms become severe. I am Charlotte Kisto with tonight's Health Watch.